6 causes of missed period aside from pregnancy. You know, we always think that once you miss your period, it's always as a result of being pregnant. That's what most people think, but there are other reasons why you could miss your period that is not pregnancy. Although pregnancy most of the time is the reason why you miss your period, but sometimes we may neglect these things because we do not know, because we are ignorant of it. Number one reason for missed period is stress. A lot of women are not aware that stress contributes a whole lot in the control of their menstrual cycle, in the control of their ovulation. They are not aware. So stress is one of the reasons why a lot of women are not able to see their period, because when you're under a lot of stress, there are hormones released in order to help you manage the stress, and these hormones prevent the release of menstrual cycle hormones. It prevents the ovulation from taking place, and then when ovulation doesn't take place, it means you're not going to see your period. So it's one of the reasons why you missed your period. Number 2, overweight. Gaining so much weight is bad as well. With a BMI of more than 25, you realize that you are already getting towards obesity or overweight. So it's very important that you monitor your BMI, not just your weight, but you have to calculate your BMI in order to know if you are running towards overweight. When you are overweight, most the hormones required for ovulation are not being released. They are not being released because a high rate of metabolism is taking place. Your body is under a lot of stress trying to make sure that everything is still within normal range. So it doesn't even, sometimes it forgets that you're supposed to see your period. So it's very important that you regulate what you eat in order not to go towards becoming overweight or obese. Then number 3 is underweight, the opposite of overweight, underweight. So with a BMI of less than 18, it means that you are underweight. Yes, it means that you are underweight. And then when you are underweight, it means your body is not even getting enough. Your body is not getting enough, so why waste the little it is getting, in the sense of losing blood during menstruation. So your body is trying to conserve the little it has. So when you even get to see your period, maybe you use like 5 parts in a day previously in the past, then you start seeing your period and you barely use like 2 parts. You see that there's already a problem, because it becomes scanty. The blood loss becomes scanty because your body is trying to conserve the little it has because you are underweight. So as you are doing your fasting, trying to lose weight, doing rigorous exercises and all that, always monitor your weight so that you make sure you're not underweight, so it doesn't affect anything in your body as a woman. So number 4 is contraceptive pills. Usually people on contraceptive pills, sometimes they see blood flow. You take your contraceptive pills for 21 days and then allow 7 days of not taking it in order for blood to flow, and all that. But sometimes the blood may not flow. The blood is not necessarily a menstrual blood. It's not necessarily a menstrual, because ovulation is not even taking place if you're under contraceptive pills. Ovulation is not taking place. So the blood is just anyways, sometimes you may not even see this blood. Sometimes that doesn't mean that the world is about to end, because in the reproductive unit where I worked, a lot of women usually come, they're under a lot of stress. I've not been seeing my period and all that. They will be so concerned and worried, like they have not been seeing their period, but they are under contraceptive pills. So it's important that you know that once you're under contraceptive pill, there is every tendency that you may see blood and you may not see blood. Yeah, but that doesn't mean that ovulation is taking place. Ovulation is not taking place, so even if you see the blood, it is not necessarily menstrual blood. But if you do not see it, there is absolutely no problem. Number 5 is being sick. Being sick. In short, I don't even need to tell you this one, because if you are seriously sick, you not even remember that you haven't seen your period. You as a human will not even remember that you haven't seen your period. Talk more of your body. Your body will not even remember that, hey, I've not seen my period, or I need to see my period. You know that. So your body is trying its best to bring you back into a normal functioning state. It's not even thinking about making you see your period. That's if you're severely sick. So some women equally notice that if they are placed on some types of drug when they are sick, they tend not to see their period. Well, this theory or hypothesis has not been confirmed, but the thing is, no drug makes you not to see your period, although some women have complained about that. So you may notice it as per you are under some kind of antibiotics, and then it makes you not to see your period, or it shifts your period upwards or backwards. If you had a 28-day cycle, you may start having like 35 days and above kind of cycle. So it will rearrange your whole system and all that. So it happens to some women, but that hypothesis has not been confirmed by any research work. The 6th reason why you may miss your period is infection. And by infection, I do not mean this type of infection that these herbal drug dealers always shout, infection or toilet infection. If you have toilet infection, come and take this one. That's not type of infection I mean. Infection could be candidiasis. Yeah, it could be candidiasis, or other types of infection could be in your system and then disrupt the whole system and make you not to see your period, because your body is trying to fight this infection. It could make you not to see your period. So once you treat the infection, then you are good to go. There is a sort of misconception that people have. The infection cannot be treated except with a herbal drug, which is completely lie. It is you that don't want to take drug. Once you take the drug prescribed for you, first of all, you have to go for a test to know the particular type of infection you are suffering from. Yeah, you have to go for test. Then when you know the particular type of infection, you'll be able to, they will prescribe a drug for you, and then if you take the drug, you will be treated. Yes, you'll be treated from the infection or whatsoever. So I hope these 6 reasons will calm you down when you do not see your period. So if for any reason you experienced missed period due to one of these reasons I mentioned, there is no cause for alarm. But if after like 3 months and it's still happening, then you need to see your doctor. Yeah, you need to see a doctor for proper medical assessment and diagnosis in order to treat you so that you'll be fine. Yes, so that you'll be fine. If you are under a lot of stress, you just reduce the stress. Rigorous exercises can equally induce stress. So even if you're exercising, be careful how you exercise. Exercise moderately, and yeah, you're good to go. So thank you for watching today's video, and I really hope you stay tuned for my next video. Please don't go anywhere. Yes, subscribe to this channel. Subscribe. Yeah, please subscribe so that we build a bigger community. So that you support my ministry. Yes. Thank you for watching, and bye.